Judy, looking.
Good morning, and thank you for having me here today. My name is Judy Kell. Many of you know me from a variety of roles. Phyllis was back in the original days of the homeless continuum of care, back when I started as the COC coordinator in 2002 on a volunteer basis, and it still is a volunteer basis. With just a couple of years in between that I was not able to do so because of my assignments when I worked for the county of Muskegon. I am also the manager of the Health Project Hub, which has connected 16,000 people in Muskegon County to a variety of services in the last 5 years. Bruce is here with me. I also manage the diabetes prevention program. The YMCA is our vendor for that. I am also responsible for the regional opioid grant in terms of implementing changes within our emergency departments to treat opioid patients, both at St. Mary's and Mercy Health Muskegon. So I've gotten to see homelessness in a variety of ways, wearing my very many different hats that I've worn over the years. So I'm going to talk to you a little bit. We can do it one of two ways. I have a PowerPoint, and we can do that and have death by PowerPoint. Or what I can do is just talk to you, and when we get to actually some neat graphics, I'll have Dominique put them up, or I can run through them. But let me give you a little bit of an idea about the homeless response system. You know, in the late 1800s through the late 1900s, it was primarily charity that took care of the homeless people in our country. And then in 1987, and the reason this is important is because when I talk about homeless youth, you'll hear this name, but the McKinney-Vento Act was passed in 1987. And that federal funding was primarily for shelters and other programs. And that's when they really started developing the continuum of care strategy. And what that means is that prior to that time, when the Department of Housing and Urban Development and MSHDA would fund programs, you might have in a community 5 or 6 programs all doing the same thing, but then a big gap in services for other parts of the continuum. So the long and the short of it is that is when the federal government said each community needed to have a homeless continuum of care that really looked at everything from literal homelessness to home ownership, and to distribute those funds, both federal and state dollars, through that system. And so, for example, all of the HUD and federal dollars, including the eviction prevention dollars, initially through the homeless continuum of care, we determine which agencies will receive that funding. We designate the HARA on an annual basis, select the agency that is the HARA, and we've been very pleased with our partnership with Community Encompass. And as the years have gone by, we have also developed a coordinated entry system for very specific populations, so that every other week we have a group of community agencies that meet together, and we go through what is called the by name list. And that list is the list of homeless veterans, homeless families, and we go through a process where we try and work to get them placed into the various types of housing that is available in our community. And that's called the coordinated entry system. And the HARA is our assessment process. That is where everything begins for homeless people in our community. The one thing that you really need to understand in terms of the homeless continuum of care is that the federal and state dollars that we get, with the exception of the emergency shelter money that came through COVID, as well as the eviction money, is really focused at housing the literally homeless in our community, not the doubled up, but the literally homeless, people that are in the shelters, living in the streets. And every year we have to do what is called a point in time count, which is happening tonight, where people go out in the community and actually talk to people who are living on the streets, count them. And all of that information is actually what the federal government and the state government uses to determine how much our community is awarded in funds. So last year, because our point in time count is tonight, we had literally 492 individuals who were living on the streets, and 377 households, and that included individuals and families. If you look at the next slide, what did our homeless look like in 2001? What our homeless really looked like is 22% had at least one disability, 10% had a mental health disorder, we had chronic disease, and then if you look at the racial composition, you can see that composition as well in terms of the homeless. And we have now been charged by the Michigan State Housing Development Authority, who is the funder that is actually funding all of the eviction prevention dollars, to start looking at how we house people through racial equity lenses. And we'll be starting that effort next month. Because there are other homeless, there is another homeless population. There are many types of homeless populations in our community, but we're focusing on the very literally homeless with our federal and state dollars, because they are the most expensive people. They use the jails, they use the hospitals, they use the mental health services. And to really stabilize that population in housing with supports is a way to reduce those costs for people returning to jail, people going back into the hospital, and people going back into psychiatric services. But as I said, and we'll go to the other homeless population slide quickly, and this is a population that Phyllis is very familiar with. It's slide 7. Is what we call, and of course, because this is federally funded, it's always named after the actual law. But when Phyllis was working, she worked very closely with me because she managed the McKinney-Vento grant student population, and that is those from 14 to 17-year-olds who are in school but are homeless. And last year there were 805 homeless youth in that age group that are attending our schools. And what our school liaisons do is they make sure they get transportation to their home school district if they're living in a shelter. They make sure that they're enrolled in all of the school programs. If they're going to college, they help them get verified for college financial aid. And they try and connect those 805 homeless youth that are in the schools with referrals to health, dental health, and mental health. So that's another target population of the homeless. And then if we go to the next slide, we can talk about other groups, youth aging out of foster care. There is another population of youth 18 to 24 years of age that, quite frankly, we have had a very difficult time counting. And the reason I bring up this point in time count is because that is the data that is used in order to get federal funds. And you're probably saying, well, you know, what difference does it make? Well, let me tell you, 2 years ago, we applied for $1 million in order to assist youth homelessness in our community. We ranked 99 in the 99th percentile for all aspects of the application. We would have been funded, except that the point in time count for that group, the 18 to 24 years old, was so small that they would not fund us. So this point in time count, I cannot stress how important it is when we're working, because that $1 million would have been a huge support in our community. I talked a little bit about our by name list, where we meet with agencies every other week. By using that process, we've had housed 183 homeless veterans. But here's another note. There are VASH vouchers. Those are vouchers that are funded for housing veterans through the Veterans Administration that we have not used in our community because there is not the affordable housing for those veterans to use those VASH vouchers. That again is a significant problem, to not be able to use those dollars to house those homeless veterans. We also know, but have not been able to count, the people that are at risk of homelessness because they've lost their jobs. And I'll show you a little bit of from my program where we've run into some issues with homelessness. We have returning citizens from prison, and the folks from Community and Compass, I am sure that they can tell you, because they hear from me all the time, about people who are doubled up. And the people who are doubled up, quite frankly, are not eligible for most housing programs, because that is not what the federal and state dollars are targeted for. So as we go to the next slide, as I said, I run a project called the Health Project Hub. And as I've said, we've served about 16,000 people in the last few years. And the income levels that we serve are people that have no money, that range up to an income of about $25,800 for a family of two. Of those people, 42% of them, so, you know, a little under 7,000, came to us needing housing. Only 10% of those folks were literally homeless, but most of them had incomes at a range that made them ineligible for most housing programs. So this is where we have to have my staff trying to deal with landlords directly, trying to find all different kinds of housing units to get them housed. And what has been very interesting that we have seen in our program, thank you, Dominique, is that our seniors are an ever-growing population of homeless. And that's for a couple of reasons. A lot of our seniors that we in that income range work with have been living in apartments with landlords that they've had for years. And landlords, as you know, we've had a huge changeover in our community. As a result of that, they are now unable to afford the rent. And it's very difficult when I have to talk to an 83-year-old woman who's living in a car. And so there are issues of affordability, especially for that area median income. So on the next slide, we're going to talk a little bit, and I know I'm just about done, the racial composition of Muskegon County. As you can see, 13% of our homeless population tend to be African American, which is pretty consistent with what the overall population is. And then the remaining are Caucasian or broken up into other groups. But where it gets very interesting is the next slide, which is what happens to people when we start to try and find them housing. And what we find is that it is, and it should be of no surprise to anybody, that it is more difficult for us to find, and as you go to the next slide, you'll see this as well, housing, and it takes longer to find housing for people who are minorities in our community. So you have the PowerPoint, because I know I've been given the time, but on slide 13, we have done an analysis of just the literally homeless and how many units of housing that we would need to develop in our community just for those literally homeless populations. And we're looking at 525 housing units. How can you get involved? The Muskegon Homeless Continuum of Care, quite frankly, we need volunteers, because when we get these dollars, these federal and state dollars, we are required, as well as with the HARA, to do a notice of intent for agencies to apply for the funding. We need people to help us review those applications, because as with every program, we need to have people who are independent of the agencies receiving the funding. There are all kinds of other opportunities in terms of volunteering, in terms of working with the special populations. I'm not sure anybody at this late date wants to go out and count homeless people tonight between 8 and midnight, but we'd be happy to have you if you were interested. And we want to thank the Community Encompass staff who are working very closely with us. We also want to thank Judge Hoops for her leadership on the eviction prevention, because the numbers that we see here, if it were not for Judge Hoops and for the dollars that are coming from MISHDA to Community Encompass, these numbers would be much worse. So thank you.
Thank you very much, Judy. We're now going to save our questions for the end and turn it over to Judge.
Thank you. Thank you for those kind words, Judith. We've worked together for quite some time on various projects, and so thank you. I just wanted to also make a shout out for the book Evicted, which was suggested by Kim at the beginning of this section of this session to read and be involved in as a group. It's a mind-changing, game-changing book, and will really help everyone understand the plight of the homeless and why it happens. And the other thing I wanted to state before I got going was Judith is so well versed in so many areas of funding. I just wanted to clarify, because if you're not in the housing game, you may not know what HARA is. She referenced it a couple of times. HARA is the organization that a community, usually a county, has to flow federal dollars through for housing. So I think it's housing, I don't even know exactly what it stands for, Housing Association.
Housing Assistance Resource Agency.
Thank you, Housing Assistance Resource Agency. So every community, usually by county, has a HARA. Our HARA is Community Encompass. So Community Encompass gets our federal dollars and spends it. And we have a lot of trust in Community Encompass for doing that. So those points I just wanted to make before I get going here. I am a district court judge. As a district court judge here in Muskegon County and pretty much anywhere in Michigan, a district court judge handles evictions, landlord-tenant issues, land contract forfeitures. And so you're naturally in the whole housing issue. And I've been on the bench 15 years, and I can tell you probably 30% of my docket is landlord-tenant and civil issues, and about 70% of my docket is criminal. And through both of those dockets, I was really appalled at the level, the number of the amount of homelessness that I was seeing. I don't, personally, I don't define homelessness as only as completely homeless. I look at it as well as doubling up, tripling up, which is what we see all the time. Families that are moving in with an uncle for 2 weeks, then the mother takes her 2 or 3 children to a grandparent for 2 or 3 weeks, then, somewhere else. I think as Judith just defined homelessness for purposes of some of those federal grants, I think we as a community need to look at homelessness in a broader sense as well. And one reason I say that is because the level of criminal activity that occurs because of doubling up, tripling up, couch surfing, so to speak, is it's mind-blowing. One huge concern is sexual abuse of children. If you can imagine, when a mother brings in her 2 children to an uncle's place, and he has friends over, or she has friends over, that's often where we see a lot of the sexual abuse of young children occurring. The other is criminal activity of juveniles or young adults, often come from a home that is technically homeless, as Judy defined it, or doubling up and tripling up all of the time because they don't have a place to lay their head down, to know that they have their own desk to do their homework at. I get upset when I hear people in the community say, well, if such and such person or such and such classification of people would just, work harder, there's every opportunity in the world, but that just isn't true when you're doubling and tripling up, moving from place to place, and you're competing with other students that have even a 1-bedroom apartment, but they know they can call home. They know where they're going to do their homework. They know that they're relatively safe from being harmed. It's very difficult for such students to progress. So I don't have the kind of hard numbers that Judith has, but I can say it was my sense after years of being on the bench that there was somewhere around 20 to 25% of Muskegon's population that was technically homeless or doubling up, tripling up. No, didn't have a place to call their own, didn't have their own apartment. They were just couch surfing. And I became very passionate about it and started what is called an eviction prevention court. It is not the first in our state, but it was one of the first in our state. And what an eviction prevention court does is we had to, the court administrator and I had to literally go out to landlords and convince them to allow a longer period of time for individuals to come up with their rent. And if they agreed to do that, they did it for all of their, they do it for all of their clients. Okay, so for all of their landlords. And then once they have agreed to have to be a part of the eviction prevention program and allow 21 days rather than 10 days, which is the law, to get their rent. They also agreed that if they got it all, they would dismiss the case so that people who were getting judgments against them, eviction judgments against them, were not getting the judgments against them anymore if they were just given a little bit more time, because the regular landlord-tenant law, I should probably begin with this, it is for non-payment of rent. If you fail to pay your rent and you come into court and there's no legal defense to not paying your rent, under the law, you only have 10 days to pay your rent. If you don't pay your rent in 10 days, then what we call a writ of eviction can happen immediately. So essentially, between the time a tenant goes to court and the time they get court officers moving their things out into the street would be about 12 days. And so we convinced not all landlords, but many landlords. I want to make a shout out to Dave Bowen. He's got a lot of landlords as his clients, and he convinced the majority of them to go with this program. And so they have longer period of time, and they get the to pay, and then they get the special bonus of getting the case dismissed if they pay 100%. We started that program in 2018 with some funding from the Community Foundation. And we were doing it for about a year, and we got Justice Clement from the Michigan Supreme Court to come and visit the court and observe it and meet some of Community Encompass leaders, United Way leaders, leaders in housing. And so she spent almost an entire day with the eviction prevention program. And that was in February of 2020. So I can imagine, what came next. 30 days later was COVID. And when COVID hit, the federal dollars that came for landlord tenant help people pay for their rent went to all the different state courts, and they were required to do an eviction prevention program that essentially modeled what we were doing. And they have continued to be required to do that. And the reason for that is we still have what's called CERA funding. That is federal dollars that are COVID dollars to pay for rent because of a lapse of payment due to COVID issues. When that dries up, which is going to be relatively soon, we will be back to this old way of doing things. But our goal in Muskegon is to hopefully continue and hopefully broaden the eviction prevention program to all 4 judges, and try to get all of the landlords to go back to the 21 to do the eviction prevention program rather than the old way of landlord tenant law. And but our goal would be someday to have more funding, either from the Community Foundation or United Way, for rent dollars, not just for staffing dollars for the court. So that's eviction prevention court in a nutshell. As I started out here, before we technically started, I indicated that our court, our Patrick Finnegan, our court administrator, and I are applying for a national grant right now that they're giving away a couple of $1 million, but only to 10 courts nationally. And we have made it through the interview process, the first interview process. And we've asked Community and Compass will be joining us for that. And we hope to get a couple $100,000 from that. And, but you know, I don't know if we'll get the money or not, but we've at least made it through the first interview process. And I want to leave you with a story that was just from 2 days ago. Well, right now I'm in Florida, but my last day on the bench before I came down to visit my parents down here, I had a woman in front of me, and it wasn't even for eviction court, okay? It was just for a minor failure to pay some fines and on a minor criminal action. And she explained to me that she couldn't pay her fines and costs. I mean, I could see her because it was by Zoom. She explained to me she couldn't pay.
You're muted. You're muted.
Thank you. So I asked her why she hadn't paid her fines and costs, and she indicated that she had been homeless for a couple of years, that when she was homeless, she gave up custody of her 12-year-old son to his father, and that she had just gotten custody of him back. And when she got custody of him back, this is all in Muskegon, they found him with his father in a vacant building. And they had been living in a vacant building, this 12-year-old boy and his father. And I said, well, please, you know, tell him how proud we are that he's going to school and doing well. And she says, well, he's right here, Judge. You can tell him yourself. And so I talked to him for a few minutes, and, you know, he appeared joyful, but she, you know, and I told him how proud I was of him for, you know, getting out of that situation and getting back online and doing school and putting his nose to the grindstone, and, you know, asked him a little bit about being homeless. And, you know, these stories are real. I mean, to see that 12-year-old boy who had just been living in a vacant home for months with his father, who, oh, by the way, was a drug abuser, is just unreal to me. So, so I'm so happy to see this be a priority with such leadership here today and with United Way. Thank you.
Thank you, Judge Hoops. And now we're going to turn it over to Mary and Anitria.
Thank you, Kim. Thank you, everyone. I'm going to start for us. I send a message of hopefulness, and I hope you all feel that. Sometimes hearing the numbers, hearing the story we just heard, in its own way, a hopeful story because it was brought to our frame. And I want our message to you today to be one of hope. I want to congratulate the Muskegon County Continuum of Care Network. Judy, colleagues, we're a part of that network, as she said. But when you think about homelessness in Muskegon County, please think of it like a continuum everywhere, from someone who is, quote, chronically homeless to people who are, the terminology used to be precariously housed, that is doubled up, that is in a position where there's not permanent housing secured, all the way. So it goes all the way from our shelters through the assessment process that we do here at the Homeless at the Housing Assessment Resource Agency, at the HARA. And then we work with all of these partners who do work in part because of all of you. And a shout out to my colleagues, 11 of whom we're going out to be part of that pit count, the pit count tonight. The reason that we're hitting that so hard for all of you is just remember that the numbers you hear, we literally will go out, and if we're lucky, we'll be able to look people in the eye who had no place to shelter tonight. Not to look them in the eye in any other way than to see them. It's about being able to see them. I'm going to just talk very, very briefly. I have colleagues, in addition to Anitria, Deanna Washburn is online. And also, we have another colleague, Steve, who you'll see there. And they will be doing the bulk of our presentation. First, just a real quick note about Community Encompass. I've been here just since October, and I'm serving in support leadership with Anitria and others. Sorry, my phone's ringing. Sorry about that. But I just wanted to cover very briefly about who we are and what we do, having that you have heard already about how we fit into the network. We are a community-based community development organization, and what that means very simply is we walk next to our neighbors, and together we are in the business of justice and building a community, building a stronger way of life for the people around us. We do that based on the assets, the gifts that people bring. That also can be seen in the work we do in neighborhood about rehabbing, about housing. It's always about building on the assets we have to make them better. We have 4 pillars in our work. We have one that deals with what we call neighboring. Steve knows a lot about this, many of you do. That neighboring section has to do with our Sacred Suds operation. It's a beautiful place where people pre-COVID were able to go, and almost it was like a neighborhood center. And we're in the process of how to do that safely. They can do laundry there, they can get their mail there, they can take showers there, but they haven't been doing all of that since the onset of COVID. But we're looking forward to that again. That's the neighboring pillar. We do food. Food is a strong pillar for us, access to available, affordable, and healthy food. We see that through our program called Muskegon Prescribes Food for Health, which is an important program to working with Hackley Community Care. We have, many of you may know about our extraordinary McLaughlin Grows Urban Farm. The urban farm is so central to who we at Community Encompass are, because it says we put a stake in the ground and we grow things that grow our neighbors' hearts and their health. It's very important to who we are, and we love it. It's on Layton Avenue. I can give you a tour. I love it too. In addition to the other programs related to that, we have a youth program. Many of you are aware of our youth empowerment program. Yup. Very, very important, because again, thinking about it, growing, nurturing, that's that work. And then the 4th pillar is our housing work, the work that we are certainly doing in the eviction prevention program through the leadership of Judge Hoops and others. Very, very proud of that. In addition, we are involved with the community health workers. We have community health workers here, lots of partnerships. And then we are always in partnership with HUD, with the city of Muskegon, to identify potential affordable housing units and houses and flipping those so that we can make them available to our neighbors. I'm going to turn over our part of the program now to Anitria Connors. Anitria is the Homeless Services Director, and she will speak more specifically about the kinds of things we're doing. Anitria?
Thank you, Mary. Good morning, everyone. Like Mary said, my name is Anitria Conyers, and I'm the Homeless Services Director here at Community Encompass. Brief bio, since graduating from Grand Valley, I have been for almost 15 years, I believe, working with neighbors. I have been a social worker within child welfare, within housing. I left Community Encompass, came back, and also within workforce development. But I love working with the neighbors, and I love everything that Community Encompass does. So I came back home. As far as it relates to housing, we have many different programs here. I won't go into full detail, but we have rapid rehousing, which we assist with those who are literally homeless. We have homeless prevention for those who are facing homelessness. So an example would be if they are in court or the landlord is going to sell the home. They have 30 days kind of to turn that around, and they can call us and we can assist with funding for finding a new place, paying security deposit and some month's rent. We have permanent supportive housing. Excuse me, I believe Judah spoke of that by name list. We get individuals who score really, really high, meaning pretty much that they have a lot of barriers to where they can be placed in permanent supportive housing, and we provide long-term case management services. We also have the outreach. The pit count would be great for the outreach. We have DeWanda who manages our outreach, where she goes out in the community, as I call it, in the trenches, and goes out in the woods, behind vacant buildings, in those vacant apartments, in those vacant buildings, and makes contact with neighbors and tries to draw them into Community Encompass for services. We also have housing choice voucher, where we can place those neighbors who are literally homeless on that housing choice voucher wait list, which is commonly known, as most people know, as Section 8. We have our project-based vouchers, but Community Encompass does own several, I believe there's 4 project-based vouchers. So that means it's another form of Section 8, but it doesn't go with the neighbor or the tenant. It stays at that building. We have a veterans program where we house veterans and provide long-term case management to those veterans. In the Shire, we had a frequent user pilot, and those were neighbors who were frequenting the hospital who were also homeless. They have been given a Section 8 voucher, and we provide services to them as well. I just want to give you all a couple of different numbers before I pass everything on to Deanna. So I like to track the number of people or neighbors who come in or give us a call on what they need. So I'm just going to give you January's numbers that we have. As we had a total of 174 screenings. This is a good number for you all to have. It's 231-728-3117. If you come into contact with anyone who is homeless or needs assistance with housing, they can call that number and complete a screening and get more housing information from us and get the whole process started with working with Community Encompass. So out of those 174 screenings, 55 of those neighbors, 55%, excuse me, were currently homeless or literally homeless. 16% were those homeless prevention cases. 13%, as you've heard this term a couple of times, are doubled up, living with friends, family, other neighbors. 16% inquired about our Sarah ESG housing program. One thing that Ms. Mary and I didn't speak of, we are Community Encompass. We are all things housing, but we are not emergency housing. We do not provide that service. And then we had a couple, less than 1% were fire victims. And then I'm going to pass it off to Deanna, who is our eviction prevention coordinator. I wanted to give Deanna the opportunity to discuss what she does every day in court for several hours a day and just doing a fantastic job at it.
Hi, I'm Deanna Washburn. As Anitra mentioned, I am the eviction prevention coordinator. A typical day for me would be sitting in pre-trials, usually Monday through Thursday, giving the information about Community Encompass to our neighbors, because many of them don't realize the assistance that they can get. And this is basically the first step in trying to prevent them from being homeless, being able to give them the information on the SARA program to apply for the assistance, to help them catch up on their back rent so they can stay in their home with their families. So every day I'm dealing with the neighbors, following up with them, making sure that they know what programs are available through us. I know monthly, I have a figure of about 60 plus dismissals that I work on from the court, based on the SARA funding and the SARA applications being processed. Some months it's over that. And then also there's some cases where it is a termination and either the landlord is selling the home for some reason and these people have nowhere to go. And then I can refer them over to the homeless services program where we would help them in that sense. So it's definitely a great program and there's so many and and I also work with Judge Hoops. She has referred so many people to me and the stories that she mentioned, I would say we hear those a lot. Every single day we hear those stories and but luckily we can give them some hope with the programs that they're not on their own and they're not going to just be living in the streets.
Kim, it's Mary McDonald. I just want to mention that when we talk about the SARA program, that stands for COVID Emergency Relief Act. It came through the COVID Emergency Relief Act. Block of money came to Muskegon County through the HARA, through us. And then my colleagues here, in addition to us, we reached out to community partners, including Mission for Area People, MOCAP, Muskegon Oceana Action Agency, and then we work with another action agency, Mid-Michigan Action Agency, who help us with particularly with utilities, those kinds of things. So we tried to move that money out, and the purpose for it, among other things, was eviction, to stop evictions, to pay so that people didn't have to move during those times, and try to do what we could for the landlords in that situation. It's a huge amount of money. Here's what I want to make sure everybody understands. As Judge Hoops says, that money's running out. And what's going to happen, I mean, it's going to stop, it's going to be done. So I'm talking like April, May. There might be a little from some other program years, but for the most part, what does that mean? That means we will have a whole lot of people who will be in a situation very perhaps similar to what they were before, or perhaps even worse than they were before that emergency relief came. So lucky for all of us, the United Way is in the effort to help with that. Thank you, Christine and Dominic and people who are helping with that, and the Community Foundation. But there'll be a lots more conversation. Is that I really can't emphasize enough, with the absence of the kind of affordable housing to get people back into, if they had to leave, if they did lose their place, there'll be lots of conversation about that. So that's what SARA is, if there was any concern.
If I can just jump in quickly, adding to what Mary said just now, because we had an eviction prevention court in place, we were able to immediately release the money to the people who needed it. I talked to people all over the country. I mean, you have to picture that every court in this country was getting SARA funding. They had no idea how to distribute it. I mean, you can get all this funding, but then how do you get it in the right hands? But because we had the eviction prevention court, it was bang. I have a brother-in-law in St. Louis that said the St. Louis courts had the money for 4 months and we're still trying to figure out how to get it distributed. So because we had such an organized eviction prevention program in place, we were very, very unique nationally.
Well, thank you all for that very illuminating discussion. We have about 15 minutes for questions. So who has the first question for any of our panelists?
It looks like we had one come right through the chat.
Yeah, is that Doug? I don't know.
Phyllis
Oh, is this Phyllis? Yeah, Phyllis. It says, please explain the pre-trial hearings. How does it fit in? Process of how it happens.
I can probably answer that. The pretrials never existed before eviction prevention program. The pretrial we was instituted after the eviction prevention court started. And what it is rather than go straight to the first hearing, which is called summary proceeding, that is in place by law and statute, we instead have a pretrial where Deanna, the tenant and the landlord, and sometimes a mediator as well, usually from the mediation center, meet and try to figure out how much the tenant needs to be able to stay and how quickly Community Compass can or cannot get them the funding.
Okay, thank you.
It does not involve a judge.
Okay,
and-
we have some,
And if we also just quickly, if we go back to the old system, it will probably no longer exist.
we have a raised hand. It looks like Anderson, maybe, is that your? Anderson's what I have on my.
Yes, thank you, Kim. Just for your information, the Muskegon NAACP, the Fair Housing Center of Western Michigan, and Legal Aid of Western Michigan have formed an association where we transmit information on civil rights cases, primarily landlord tenants rights, things in that nature. We came together because all three of us were getting calls on several properties that were formerly owned by Bishop Wells. It's a new management company. We had a situation where about 20 to 30 families were about to be put out. And when we got in there and Legal Aid started looking, Fair Housing started looking, their response time to what we wanted to happen was within days. That's number one. I was really surprised. Some of the problems were just bad. This new company that has taken over the management of these facilities, they have bad managers. People were being overcharged. People were not being given receipts, a lot of different problems. So just so that you folks know, we are planning to meet with several groups, probably in the next 60 days to hear what their complaints are. If you are interested in attending these meetings, why don't you give, you can either, I'll give the information where we're going to have the meetings to Dominique, and she can email people on this committee that's interested in hearing what those problems are. Thank you.
Thank you, Ms. Retha. We have a question, from Mary Ann Gorman. Are there municipalities or agencies working to develop affordable housing? Let's see, there's more. Affordable housing on the scale that is needed to meet the need.
No. And part of the issue is that there are private developers that would be willing to work with us, but in order to get the low-income housing tax credits from the Michigan State Development Housing Authority, you have to be able to provide supports to those folks living in those units, and there are not support dollars in this community. So there are developers who would come if there were opportunities for those support dollars.
Judy,
But
can I ask go ahead.
But on the whole, again, it's that, the city of Muskegon has done a wonderful job in terms of creating some additional affordable housing. But when we're talking about people that are at again, I know I keep saying the lower income of area median income, but that is, you know, of building a place for someone to buy at $125,000 is out of the reach.
Judy, can I ask a follow-up question? You and the other panelists have shared a wealth of information with us. And I'm assuming, so we've heard about the issue of mental illness, and I think by extension, lack of treatment, like same with, you know, substance abuse. You know, this is a multifaceted topic, but would you say the priority and the thing that could have the biggest impact is additional affordable housing? I mean, is that the crux of the issue?
I would say it is, but it has to also be paired with supports for people in that housing. Because the people that Judge Hoops are working with, and the people I'm working with, and the people Community and Compass are working at are not going to stay stably housed unless they have some long-term supports to help them stay in that housing. So it is a two-pronged approach, because you can build a lot of affordable housing, but if people are getting into the housing that have a substance abuse addiction issue that is not treated, or a mental health issue that's not treated, they're either not going to stay in the housing that long, or they're going to create the situation with the landlord where the landlord wants them out. So there is there are places all over the country. There are places all over the state. One of my many jobs was to be, many years ago, in both Ottawa and Allegan County, I created about 100 units of permanent supportive housing for people with victims of domestic violence, people with substance use addiction, mental health, and chronic disabilities. I would say that there are wonderful success stories. There have been 20-year studies of how long people stay in housing if they have the supports to stay in that housing. So it is a two-pronged approach, and jobs are also another, jobs and education, so people can get in daycare.
Thank you, Judy.
It is
I would just follow up to Judy's. She knows far more than I do, and statistically knows far more than I do. But I think there are a lot of people who just need the opportunity to get housing. I agree with Judy. I think that there are a lot who have mental illness and a lot who have substance abuse problems. But even if you just talk about the elderly, because when she was talking about the number of elderly people now who are getting evicted from their homes, and their inability to find new housing, you just take that, you'd be, I mean, they don't necessarily need support, is what I'm trying to say. I think there is a huge population that doesn't need support. They just need housing that's affordable. For example, there aren't nearly enough Section 8 vouchers.
Right.
I mean, people are begging for Section 8 vouchers. They're on lists for Section 8 housing vouchers. So
yeah,
and
it looks like
we have the VASH vouchers for those veterans that we can't use in this community because we don't have the affordable housing for those vouchers to be used.
Yeah, and Mary McDonald was nodding her head as well, Judge Hoops, as you were speaking. We have another question from Ms. Jones. Go ahead and ask your question. I see your hands raised.
Thank you. This is a two-part question. My name is Nefertoria Jones. I'm a community volunteer and liaison. And the first question is, I have a young lady who stated that once her landlord received the CERA funding, he then intimidated her to leave the property, and he no longer wanted her there after they had prepaid her back rent plus her 3 months rent in advance. So that's the first part. The second part is the other individual that I'm assisting, a lot of landlords in Muskegon, because Sarah is assisting with the rental assistance, they're going up on people's rent $200, $250 additional dollars than what they normally would pay. So for instance, a lady had an apartment where she was paying $500 a month. Once the landlord realized that Sarah was paying, he now changed her rent to $750 a month. Are there any repercussions for landlords taking these type of actions?
Great question.
I can say I do run into this. I completely agree with Ms. Jones. I have run into this with dealing with the court cases for the Sarah Fund. Anytime I see something like this going on, I do refer them to legal aid. Because legal aid has been a great resource, and sometimes they are able to turn those situations around, because I have seen that. And there's some cases where we weren't able to turn around, but we were able to put them into one of the homeless services programs and help that neighbor. But I mean, you are correct. There are landlords that are doing this, but I do what I can to refer them to legal aid. And Carl and Sabrina work. I always tell them that they need to go work their magic on it, which in most cases they will, because if the landlord, I think, if they realize that people are recognizing what they're doing, they tend to stop doing it. I don't know if that answered what your question was.
Yes, thank you. I have some guidance now. Thank you.
This is Mary McDonald. I would suggest also maybe Ms. Reetha, what you were talking about in terms of the collaboration with the NAACP, the Fair Housing Center. Maybe if, for example, if we hear of situations where a landlord has been accused of that once, again, now we've got a trend and now we have a different conversation. Right? Then because it came up in the domestic violence movement, and to be able to quote, prove intimidation can sometimes be tough. But when you hear it once and then you hear it again, you help the neighbor, the first neighbor, and then you figure out where you're doing, what the trend means. So maybe that's a conversation we all can have.
I love what Mary just said.
Whenever you find repetition like that, okay, and that's what it is repetition. You need to send that either over to legal aid, or you can send it directly to Fair Housing, or else catch Eric Hood, who is the president of NAACP, and voice that complaint, and we'll start a preliminary look at it. You know, you don't want to get us in there and have us do a formal investigation. We will, but it's long and lengthy, and we will win. But when you have people that's doing that, moving that from increasing that rent by $200, that's not an affordable unit anymore. That person has to be cost burden. So yeah, we are into investigations and enforcement, those three agencies. So that should come through us. We'll take it on.
I love what Mary just called this, and that is a movement. I mean, the affordable housing is I think needs to be the number one, or one of the number one movements in this country, but that's exactly what it is. It has to be multifaceted, and I really give everyone at United Way a lot of credit for leading the movement here. But that's how we have to think of it. You know, it's going to have to come from all different directions: NAACP, United Way, the courts, the community foundation. It's a movement, and it's a critical movement. because it touches so many facets of an individual's life.
Yeah, I'm gonna thank you, Judge Hoops, and thank you to everyone. I need to wrap us up so that Christine's gonna, she's gonna take us home with a kind of a state of the state and what's going on at the United Way. But I want to thank everybody again. This will be a year-long conversation for this group. So we'll have plenty of time for additional conversation, additional questions. I think that you all have mentioned a number of ways that we might assist. Well, you know, the first one is just to continue to educate ourselves and to increase awareness of the what's going on in the community in which we live and work and love. And I heard volunteerism and some other ways. So we'll continue to keep that in mind, and we'll be reaching out, I'm sure, over the course of the rest of the calendar year to have to engage with you around further conversation. There are some things in the chat. There are some additional questions that we just don't have time for, but if somebody wants to take a look at that and answer the person in the chat, that's great. There are some thank yous in the chat. And then Anitria gave us the phone number for Community and Compass. So let's make a note of that. And with that, I'm going to turn it over to Christine.
Thank you, Kim, and thank you, panelists, for joining us today and really giving that great update on where we are and what we can do to help. It's just incredible. Some of you know this, but part of the reason I do the work I do is because my mother had such a problem with housing throughout my life, and moving from place to place to place. The only stability we ever had was living with my grandparents for 7 years, which I'm sure, thinking about that now as a grandparent myself, that was a huge burden to them, but we were certainly blessed, more so than other families, in having them. But she eventually got into Section 8 housing when I was 15, and she had to fight her way in because her income was too low for Section 8 housing. And I stood up and forced her to go and talk to the board of directors and make her way, and she won. And she, even though her income finally did get above the qualifications, she paid the extra to stay because she had fought to get into that place and she wasn't leaving it. So she died in that place. So housing, needless to say, is a great passion of mine, and trying to create fairness, try to create affordability. Everybody, every child wants a home. Every person wants a home of their own. Maybe there's a few that are more nomadic creatures, but we can all agree that finding that housing is so important. So really appreciate the United After Work group for picking this topic for the year for us to explore more and figure out how we can do more. Just to give you an update on some of the other things United Way is working on. At the tail end of last year, we really were listening to our community and what we were hearing from our agencies. And so some of the issues we've always worked on are the ones you just talked about, importance of quality daycare. It's wonderful to have Bruce Spolman here, who's taken a leadership role in creating a daycare in our community downtown. And, certainly we're working on education. Next month, we launch our Beards for Books to support our Dolly Parton Imagination Library program. With that and Reading Corps and so many other wonderful programs that we support to just try to get people ready for school to learn. But this, again, at the end of the year, we really were looking at the unemployment figures for Muskegon County are 5,000. And what we're hearing from employers is there are so many more jobs than that 5,000. And we're not getting the employees for those jobs. So really focused on getting everybody to think about what more we could do to assist those individuals who are currently not in employment to make their way, remove the barriers that keep them from becoming employed. Housing is certainly one of them. If you don't have stable housing, how can you, it's hard to get a job. Community Compass, again, creates a mailbox, wonderful. So there's some things already in place, but we have to all be thinking, what more can we do? Because it's a unique opportunity where employers will actually bend probably in all of my years in this work, I have never seen employers be so willing to help hire people and to help remove barriers to employment. So I think it's just this one unique year that we need to be a full court press. And how do we help people who want to be employed find that employment opportunity? So we did have a large meeting with all of the leaders of the Health and Human Services organizations and the economic development organizations to really challenge them to think bigger this year. And so I'm challenging everybody on this table to also do the same. And the two issues, again, how do we get more people employed, and how do we get more individuals who are ALICE to be confident to apply for something greater, to go after some of the skills training that's available now through the community college, for them to move up. And so really to get people to see, while we've all been kind of in our homes and in our houses and locked in for a couple of years, that this is that unique opportunity to go after some of those opportunities, whether it's job training, that this is the year to do something more. And how can we encourage and use our resources, our connections to connect people? So we'll be looking for new ways of doing that all year. So those are the two things I really wanted to point out, or one of the key things, but the other piece of that is mental health. So we talked about that already earlier, but that stress is one of the reasons that's a barrier for getting someone to have the confidence to even seek that greater opportunity. So we can be thinking about ways to do that. And so those are the two pieces I wanted to point out in terms of what United Way is working on. The other thing I wanted to make you aware of, we are reinventing our resource development work, taking a greater look at how we're doing resource development with COVID and prior to COVID, where we're seeing a change in how people give. And so we are actually currently posting, you'll probably see that we're posting and looking for someone for a chief development officer to come in and work with us, work with our task force that we're creating to really look at the next 3-year plan for resource development and look at it differently. So we'll continue to do the work that we're doing while we kind of reinvent ourselves. So just wanted to bring you up to speed on that work. And I think a couple members of this committee might be joining in that task force to help us rethink that work. And certainly would entertain coffee with any of you if you wanted to have a greater discussion about what more United Way can be doing. But one of the key things is we need to look at individual giving more. We've been a workplace campaign fundraiser for a long time, and the workplace is changing, and as all of us know. And so we need to be thinking about how do we meet the changing world that we're living in. So those are the two key aspects. And then let's see, can I ask Dominique, are you able to share a little bit of an update on some of the other things that are coming up that I might have forgotten about and ways that people can connect with United Way?
Yes. Sorry guys. So we are in the middle of like Christina mentioned about Beards for Books and getting ready for our Dolly Parton's Imagination Library program, but we are in a couple different recruitment pieces with our RSVP program, and I know Lynn's got a couple urgent volunteer placements that we are looking for. So if you are interested in getting involved right away, Lynn definitely does have some greatest needs that I'm going to redirect to her. But then just to know what's kind of heading our way, we are starting to hit our literacy quarter. So March is reading month, and within April, really talking about mentorship. So you'll be seeing a lot of stuff coming through United Way about early literacy, tutoring programs, and then also starting to get into more of those mentorship pieces, whether that's through Big Brothers, Big Sisters, Girl Scouts, Boy Scouts, and all of those fun things that really help develop young leaders, right? So stay tuned as we're kind of going through that more, and excited to be continuing to work on the housing talks with the United After Work group. on your guys' focuses, but then just know that that's also coming on the way. Lynn, you want to talk about what's the urgent needs?
I will. Thank you, Dom. And thank you to everyone. What a wonderful job and what a wonderful information that we learned today. So with RSVP, it is a retired and senior volunteer program that is for volunteers that are 55 and older. And we have many, over 20 different station partners. But I want to talk to you about a Mission for Area People. They have been one of our station partners, and still no one has signed up to go in and to help them. And so it's very important that they have a baby pantry. They also have a food pantry. We're really looking to get at least 1 or 2 volunteers to go over there. The LST, USS LST, is opening this year. And if we cannot help them with volunteers, they are going to have trouble opening for any length of time. We have veterans. Roger Nope is one of our RSVP veterans. He's even has a display in there for his service. But it is so important that if you have the opportunity, it is spring. We have VITA happening right now. So we know, because I just talked to one of the volunteers yesterday, that they don't have enough volunteers for VITA. Sadly, I learned that the VITA program in Oceana, because they didn't have the volunteers that they needed to be able to get the tax, not only that, to prepare the taxes, that they're not active in Oceana this year. So when we're looking at, we have these different areas that need volunteers. Big Brothers Big Sisters has no RSVP volunteers. Why? The Y Swimming Program, no RSVP volunteers. The need is there, and it's a wonderful program. I would love to talk to you more about it. If you're not 55, you may have family members that would be interested. Some volunteers are seasonal. We would work with them to impact the community greater. So that's RSVP and their needs. Hopefully I'll get the opportunity to talk to you again. Thanks, Dom.
Christine, is there anything else that you want to mention or have one of your team mention before we adjourn?
Just one other thing. So next month, so I want to, I guess, put on your radar screen. One of the things that we're going to be really pushing over the next couple of months with the new budget is the governor and the representatives have been talking about earned income tax credit. So Lynn just reminded me when she talked about the VITA tax preparation program. So earned income tax credit in Michigan was cut a few years ago. It used to be, I believe, 20% in Michigan. And so that is a real big help if you wanted for Alice, right? To keep that Alice working or keep low income people working is to have those credits. And so one of the pushes that we're making this year is to really get that, to increase the earned income tax credit back up to 30%. Some are pushing for 60, but I think we're putting in pushing for 30%. So, you know, anything we can do at any rate greater than 6% will help our Alice families so that they're paying less in taxes and so they can afford this cost of living increase in that's happening all around us. So just be thinking about that. We might be looking for, next month is kind of an Alice Advocacy Month. So we might be sending out and asking you to write letters to support earned income tax credit to our representatives.
Yeah, I'm sure that personally I would be happy to do that, and I'm sure there are others. So if you could give us the talking points, then I'm sure many of us would be willing to do that, Christine. Okay.
Before we adjourn, I have a question. I have a question.
Can you put it in the chat maybe, Steve? Yeah, you're muted now.
I send it to Dominique, but
We'll call you back, Steve. If it's for us.
Okay. Are we ready? We're ready to adjourn then?
Yeah, are we going to lunch after this meeting?
Yeah,
Or-
yeah. So
do I have
much,
to-
so
I
much.
have to come far away for that though, right?
Yeah, so much for our changing the meeting so we could have lunch. We moved the meeting back a half an hour so we could all go to lunch together, and then we had another COVID spike. So much for that. But
Yeah.
maybe by April or May, we'll be able to start doing that again. Another opportunity for us to just create fellowship. So we'll be back in touch to talk, to give you more details about the April meeting once we confirm whether or not we're going to be back at the Y Child Care Center with our project. If the timing of that doesn't work out, then I think maybe we'll do our discussion on the book Evicted, and maybe some of our panelists from today would come back and participate in that discussion with us. So more information to come as we finalize our plans for the April meeting. Thank you for your time. Again, a special thank you to our panelists, and stay safe, stay warm.